Hey guys, Cole Beeler here with Infection Prevention. This Viper is about nothing but chlorhexidine. Baby. I know that no one likes baths. They're disgusting. I mean, it's like sitting in your own filth, like someone is making some sort of man stew, and the more people there are around, the more awkward it gets. I know that nurses don't like doing it, and patients probably think things are weird and creepy too. I mean, the only person that gets any sort of worth out of this whole process is the friggin' sponge. But we're taught at a very young age that baths are good for you, and even though bathing becomes less common as we get older, our patients need baths while they are in the hospital to protect them. But don't call it a sponge bath. Patients hear this and they're like, yeah, right, I am not in the mood right now for a freaking bath. Don't they know I'm sick? I've got better things to do, like watch Maury. But they aren't really getting a bath with soap. We're using chlorhexidine. Regular soap just tries to bind up bacteria so the water can wash it away. Chlorhexidine binds to the bacterial cell wall and rips a freaking hole inside the bacteria, leading to a gratuitous mess of microbe blood and gut spilling out all over the place. Chlorhexidine is kind of like a bunch of zombies eating some unfortunate teenager's entrails. So I guess it's kind of like taking a bath with a bunch of zombies, but instead of brains, they're like eating bacteria. So it's like a really helpful broad spectrum bunch of zombies. So what's the data? In a meta-analysis of 12 controlled trials comparing chlorhexidine bathing to soap and water bath, chlorhexidine was found to cause a statistically significant reduction in all-cause hospital onset bloodstream infections. And in another multi-centered randomized, non-blinded crossover trial evaluating daily chlorhexidine versus soap and water with 7,727 patients enrolled, the authors found reduction in acquisition of multi-drug resistant bacteria, as well as reduction in development of nosocomial bloodstream infections and central line associated bloodstream infections. And it's a fire and forget strategy. This is a cluster randomized multi-centered trial, 43 hospitals looking at MRSA screening and isolation versus targeted decolonization versus universal decolonization with chlorhexidine. And they found that universal decolonization was more effective than either of the other strategies for reduction in rates of MRSA clinical isolates and bloodstream infections from any pathogen. We used Hibiclen's foam on a wet washcloth to hit these targeted areas in the diagram on the patient. We also hit the lines and the drains. If you use Sage wipes, focus on the same areas for about 20 seconds per wipe. So what would you do if the patient refuses their quote-unquote bath? Well, first thing, remind them that it's not a bath, it's a treatment. What would you do if they refuse their antibiotic or their Lasix or their friggin' chemotherapy? You would escalate to their provider, and you should escalate to infection prevention. Refusal of chlorhexidine is equivalent to refusal of other medications and puts patients at risk for bad things happening. Do everything you can to encourage the bath, but of course let us know in infection prevention if you're having trouble. Another scenario that we see is when patients are labeled as, quote, self-bathers on admission when they look okay, but the clinical status changes and they are no longer able to care for themselves. In general, if your patient's activity level has been restricted to up with assist or bed rest, they are likely not strong enough to self-bathe either, and chlorhexidine should be administered by nursing. So in summary, chlorhexidine treatment kills bacteria and fungi on the skin. This prevents development of hospital-acquired bloodstream infections, which can have a mortality up to 30%, and it helps prevent acquisition of multi-drug resistant organisms. Daily chlorhexidine bathing is the standard of care and should be given to all of our patients. And even though patients may not like it, awkwardness fades, and our larger goal should be to prevent harm instead of worrying about some transient uncomfortable conversation. Thanks for watching me. Email me with questions and follow me on Twitter.